Hello, everyone. So today we have started with the Kickstart series on the module General Gynecology. So what are the topics that are covered in this General Gynecology? Let us have a look. So most commonly, you will get some menstrual disorders like it could be primary amenorrhea or secondary amenorrhea, or it could be heavy vaginal bleeding. Then it comes with the topic of pediatric and adolescent gynecology. Again, here you can have a puberty girl coming with menorrhagia. And could be some emergency gynecology too, wherein adnexal accidents like ovarian torsion or adnexal masses, something like that. It could be combination of one or two modules too. It could be with the gynecology and postoperative module. Then most commonly, the tested one is a chronic pelvic pain with endometriosis. Again, here it could be combined with some fertility, like asking for fertility options with the gynecology in the gynecology module. Then you have this menopause and HRT, which is a very common tested task in this module, and benign tumors like fibroids and ovarian cyst. So let us see what case we are having today. So we'll keep a reading time of 2 minutes. Usually you will have 2 minutes outside the cubicle, but to save time here, we'll just keep it for 30 seconds and then we'll start with the station itself. And we have our Dr. Soumya, the CEO of StudyMEDIC, as my role player today, which is a reverse we are going to have today. Hi, Soumya.
Hi, Ayesha. It's good always to do task with you. And yes,
Yeah.
when we are doing the task, it is just like I'm the role player and you are the candidate. So I'm sure you would be doing a wonderful job. Yeah.
Yeah. It's a exam feel like today for me.
Yeah.
Okay. So let's keep the timer.
Aisha, would you wish to show the next slide so that
Yeah. I think we can start.
Yeah.
Hello, I'm Dr. Ayesha, one of the doctors in the clinic today. May I confirm your name and age, please?
Hi, I'm Mrs. Linda Grace and I'm 31-year-old.
How can I call you?
Linda should be fine.
Linda, I understand from the GP notes that you have some concerns with your sexual life. Is it right?
Yeah, that's correct.
Is it okay I ask few questions to know more about you and then we can come to a safe management plan?
Sure.
Yeah, Linda, can you tell me in your own words, what is that you're having concerns with?
I'm not very sure because obviously I have one child, Tina, who is around 3-year-old, so everything was fine. But of late, sex has become very difficult for me. It's very, very, very painful, and uh, obviously, it is affecting our relationship as well. And my current boyfriend is definitely, even though he understands, but I'm worried whether this can affect our relationship as well.
I'm very sorry that you're undergoing such a difficult situations. So how long has been this condition affecting you?
I think almost like for a few years, I would say, but from last 6 months, it is much more.
So how about your periods?
They are normal. I do not have any problems, and I have no issue with them.
So what about your smears? Are you regular with your smears?
The thing is, like, I had taken one at the age of 25, but
Mhm.
since this is very painful, I haven't gone for my smear testing at all because I feel uh, right now this could be very difficult for me because it's quite painful for me.
I'm very sorry to hear that too. So what about the contraception? Are you following any contraception?
Uh, Pills, yes, I used to take, but as I said, hardly we can have sex now. So, but I am on pills.
Okay. Do you have any other medical condition for which you're following with the GP?
No, I'm generally fit and fine.
Any allergies?
No.
Mm-hmm. Some questions which might find intrusive, but we generally ask to all of women, who are suffering from such type of condition. Is there any, unpleasant memories or unpleasant thing which is going around you in the recent past?
No, I don't think so. Like anything like that is there because see, this is my uh, uh, actually like third or fourth part he met with an accident. So it was a very traumatic phase. That's when I found this particular guy.
Mm-hmm. Mm-hmm.
Things have been smooth. I have always liked this company. It is not that I do not like. Somehow, when it comes to the sexual life, it's becoming very terrible, and I am not uh, able to figure out what to do.
See, whatever we speak here will be very confidential. We'll not let others know without your permission. So if there is anything which I should be aware of, you can just talk to me.
No, things are okay. I don't think so. There is anything particular which I can think of.
Because in UK, 1 in 4 women, they experience some traumatic things in their life. So if that is similar to that in your case, you can just tell me so that I can help you.
No, I didn't quite get you. Or like, what were you trying to tell me? So I didn't get you actually.
Yeah. 1 in 4 women in UK, they experience some violence in their house with their partners. So if that is the case with you, I can help you. Is there anything like
I
that?
wouldn't say violence, but yeah, I wouldn't say violence, but yes, he gets angry at times, and because probably because obviously there were a couple of situations which we had a financial crisis at some point of time, so that could be the reason. He's a nice
Mhm.
guy, but yes, he if you particularly ask me, he does get angry, and sometimes he can be physical.
I see. I'm very sorry to hear that. Some more questions regarding that. Is it okay? I asked about it.
Mhm. Yeah.
Has he ever threatened you anytime?
No.
Okay. Regarding your child, do you feel he's acting the same way with the child?
No, he's very friendly with Tina, so I don't think I have ever seen. And even when these things happen, he makes sure that she's not around. And he's quite a loving father in that way. But for me, I think it's just because of the difference of opinion which arises, and sometimes he could be really physical. Probably,
Okay.
it's all because of me. I'm not sure. Probably that would be the thing.
That's good that he's very friendly with your child. Okay. Some more personal questions. Do you smoke?
No,
Do you drink alcohol?
no,
Any drugs for fun?
no.
Okay. Thank you for sharing all this information, Linda Grace. Is it okay I examine you in the presence of Chevron?
Uh, you can, but
I,
it looks very
yeah,
painful actually.
yeah, I do understand, but I will be very gentle in the examination. And if you feel pain at any time, you can just tell me to stop it at that moment.
Yeah. So the thing is, like I think the GP had examined, probably he would have sent you across the findings. So probably you could go through because it is really difficult for me.
Yeah. So, Linda, from your examinations, I see that there's no discharge or there is any mass coming from there, nor do I see any scarring. But when I try to insert something, there is some spasm of your vaginal muscles, and that condition we call it as vaginismus. Have you heard about it?
Um, Not exactly, but I do know that because I do not allow him to go inside at all. So I know that there is something seriously wrong. But again, I am unable to figure out why.
Yeah. Sometimes what happens is that it's all because of there's nothing that you think of or anything, but some fear or some fear of something getting inside your vagina makes your vaginal muscles contract automatically, and that's how you get all this pain.
Okay.
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 So we have treatment for that, which can be cured. Can I explain it to you?
Yeah, sure. But do you think, but I already have delivered one child, so why should I have this?
Yeah, this is what sometimes, some fear or some sort of fear towards the partner, okay, because you did not have all these conditions earlier. The fear which you have of the partner might make this muscle spasm.
Okay.
So that is how, you get this type of pain during sex.
Okay, so
Okay.
that could be an element, obviously, because when he's physical, obviously I'm a little scared. But
Yes.
how do I go about all this? Because I'm clueless.
Yes. So first of all, I would like to say that regarding if you're very scared of your partner, or one more thing I just want to ask is, do you feel safe to go home now?
Yes, I don't think there is any like he's like I feel I'm safe at home,
Mm-hmm.
except for when he's angry. As I said, probably this could be my mistake. I don't know. Probably I initiate conversations. I'm not sure.
No, Linda, you should not think that it's due to your mistake. It can be done, if mutually done, it can be sorted out. But anyway, I can tell you regarding this domestic violence a few some more points, because some women may not come forward to seek help regarding this violence, but whenever they come forward, there is always help. Okay. I can put you in touch with the counselors who can also the safeguarding services who can talk to you, and they can also provide some support groups wherein you will have a independent advisor regarding your safety, and also they will explain to you how can you go about it if you want to talk about the safety, or if you want to talk about any accommodations. Now that you feel safe at home, you can just talk about the safety part with them too. Am I clear
Mm-hmm.
so far?
Yeah, but will they tell my boyfriend about what happened?
No, it will be all confidential. Even whatever you have spoken now, it will be in the record, but not in the handheld notes or in which your partner can come to know about it.
And will they report to the police?
No, reporting to the police will be done only with your permission.
Yeah. Okay. Because I
Uh,
really definitely, as I said, he's a very loving father to Tina, and he's a good chap. Probably, I don't know. Sometimes he can be really, really angry. So I do
yeah.
not want to lose on him. At the same time, that makes sense. Probably because whenever we think of having sex, I'm always worried. All those flashes come to my mind.
Yeah. I'm very sorry to know about it again. And one more thing is, whenever you feel unsafe, when he's very angry, you can also have some escape plan. Like you can keep some spare car keys and your clothes, and also the important documents in a separate bag without his knowledge, and you can keep it in your friend's home or workplace. And whenever there is a need, you can escape quickly with the child. Okay, am I clear so far?
Yeah.
Okay. And also, I can give you also the information leaflet where there are important phone numbers or telephone lines, which are 24-hour helpline, which you can make use of it.
Okay.
Okay. And regarding your condition, I can put you in touch with the counselor where they can speak about the condition. And by talking to them, all the negative thoughts it's taken out of the mind, and they fill with the positive findings. And also some therapist who will help you to, you know, relax you and help the relaxation of the vaginal muscles too. And also exercise therapist where they will help you to squeeze and relax the muscles so you can gain control over the muscles. Am I clear so far?
Okay. Mhm.
And also some trainers, what we call as vaginal trainer, it's a tampon shaped of different sizes, where you can insert a very small size initially and then go on gradually increasing the size. That will help you to stretch the muscles and help to overcome these conditions.
Okay.
Yeah.
And also, I wanted to know, can I speak to somebody? Because I'm not sure. First of all, I was never thinking this could be because of whatever has happened to
Mhm.
with my partner, the boyfriend. I never thought so. So, could I speak to someone who can uh, probably talk more about it and probably get a
Yeah,
relief?
yeah. Talking therapist, this is what we call it as cognitive behavioral therapy, where you can talk with those therapists and that will help you to overcome these situations too.
Okay. Okay, that
Okay.
should be fine. Yeah.
Yeah. Anything else you want to know from me?
No, because I think all these days I was thinking this is something which I could go on with, but probably I would sit with him and have a word as well how to go about.
Yeah. Yeah. Okay. I'll give you information leaflet. You can go through it and also the important telephone lines where you can seek help. Thank you.
Okay, thank you. Yes, yes,
Yeah.
Aisha. So
So,
I think like you went on well, but probably I was thinking that like initially when I said I had to tell you twice that probably this is my mistake. That's when you started telling no, it is not yours. Probably you could have done that in the beginning itself.
mm-hmm.
And uh, I think the rest of the things were okay. But initially, later on, you brought up that. What happens is sometimes in this thing, in 10 minutes, you might not get the time. So it's always a good idea to first talk about the domestic violence and then a bit about vaginismus, which you did the alternative way. Otherwise, the communication was quite smooth and you were not in a rush to finish the station. And obviously, I was not very happy to giving in. And probably, like I never realized that this could be the part of it. And I thought getting a few, like a few, probably a few physical things is okay, I was thinking. So that's how the patients come with, right? Even though she's tolerating much, so they wouldn't realize this is something which could be part of all this. So I think you did a good job. Yes, counselor. I was very particular that I want to talk. So if you go that stepwise, probably I think consider CBT and then talk about other things. I think
Mm-hmm.
that would be fine. And yeah, initially definitely I felt you underplayed the element of domestic violence, but later on you covered, so it doesn't matter.
Yeah,
Yeah.
okay. Mm-hmm. So this is how the station will go, because sometimes, the role play will never talk. Here, Soumya has talked a lot. They will never talk. They will just will not even have eye-to-eye contact, and the answers will be very short, either yes or no. And then it will be like they will not even want to speak or in a hurry in the consultation. This is how the element hidden agenda will be. At that point, that you have to make sure or that will hint out that it is a case of domestic violence. And then, yes, you have to talk about the domestic violence and also covering the vaginismus part. This is take home message from today's station.
Okay.
Yeah.
Sash, if you would briefly tell about the domains, if you want a bit.
Yes. Domains regarding this will be a lay examiner tested task mostly, and your introduction has to be very good, and your empathy has to be there throughout the station. Yes. Where is this? Just-
Yes, Aisha. So probably if you could
Yeah.
just brief
Yes.
them
Yes.
about the main thing here is missing an element of domestic violence would be a uh, real difficult thing,
Yeah.
right?
Patient
So
safety.
that could be
Yeah.
the most difficult thing for the patient safety.
Yeah. Patient safety, I think you have to confirm the name and age, which is there in all the stations, and exploring concerns and taking her into confidence. You have to build a rapport such that she will open up for you. and referring to social and safeguarding services. And if the child is involved, you have to involve the child safeguarding services. You have to inform the police and ensuring safety. That is of prime importance here. Communication, yes, you have to be empathy throughout the station and explore the type of abuse. Like you have to ask whether he's using any weapons, and what about if there is any sexual coercion. Those things has to be explored. And regarding the applied clinical knowledge, the explanation of the condition, talking about the domestic violence and vaginismus treatment. These are the important things that has to be there in this session. Yes, Soumya.
Yeah, that's it. So this general gynae stations could be actually it could come as a combination of general gynae and then sexual reproductive health. So it could be combination of those, and part 3 exams always comes as a combination of different modules. Okay, so I think it was a well done, and thank you, Ayesha. Thank you.
Thank you. Thank you very much.
And guys, don't forget to subscribe these channels, because Kickstart series is a role reversal even for the mentors. Okay, so that would add value to your preparation as well. Thank you, guys. Thank you so much.